Educating Society about the First Years of Life. A talk by Aida Cable, Chief Advisor to the Royal Foundation of the Duke and Duchess of Cambridge on the 20th of April 2021, given in front of an invited audience for Foundation Years Information and Research. Aida has worked on high-profile charitable initiatives for over 10 years, collaborating with a wide range of stakeholders from voluntary, public and private sectors. Aida was Chief of Staff of the inaugural Invictus Games in 2014, led on the Heads Together mental health legacy work of the Royal Foundation, and over the past 3 years has worked with the Duchess of Cambridge on her early years agenda. Aida is also a trustee of Family Action. Prior to working in the charity sector, Aida had a 16-year career as a commercial lawyer.
During 2018, we spent a considerable amount of time with the Duchess of Cambridge, speaking to experts in the early years, including some individuals who are on this call today. And we spoke to academics, practitioners, and charities that deliver support services to parents and families. We wanted to know how she and we could make the most difference in supporting the cause of the early years. And of course, all the experts we talked to were passionate about the importance of the period from conception onwards. And they made out a very compelling case for the Duchess to provide leadership around the issue and to create a platform to unite those who work in the early years. So those were the sorts of things that those experts had in mind when they thought about what we could do best. But we were keen to hear from the public and understand their perspective. And we were encouraged to do so by the experts, because one of the things and one of the problems they identified is that often in earliest work, and it's not unusual in this respect, we fail to ask the views of the very people that we're trying to support. We fail to engage with the beneficiaries. And we were right to do so for reasons which will become clear. And some of you may have heard Dr. Conti's presentation last December to this very group. And one of the key points she picked up from our social research is what I can best describe as a really important mismatch to have identified between the views of the experts and the views of the rest of society. What we heard was that the majority of people, and that's 76% of the public, do not see the early years as having critical importance for outcomes in adulthood. What they said to us was that they saw other periods of childhood as being at least as important, if not more important. And that's a very important starting point for all of us as we think about the work that we are trying to deliver. So since November, we have been using this key finding and the wider data, together with our consultation with the experts, to develop the Royal Foundation and the Duchess's strategy. I'm afraid to say there's going to be no big reveal today. There's more to come over the summer, and I would lose my job if I were to sort of blow things too early. But what I do want to do is share with you some of our thoughts about educating society about the first years of life. Broadly speaking, the Royal Foundation's position is quite simple. What we think we need to do is shift what I'm going to call the misperception that I've already spoken about. We need to shift that misperception of 76% of the public who feel that the early years are not critical. We feel that we need to educate society about the first years of life, because early childhood matters not just to children and not just to their parents, but it matters to all of us. And we need to educate everybody in society because we can all contribute in some way or other to better outcomes in the early years. whether that is as parents or grandparents, whether that is as employers or early years professionals, and whether we are politicians or voters. So the Royal Foundation feels that education is key, but who needs to be educated and about what? To help us think about these questions, what I've tried to do for today is to group my thoughts under 3 headings. The first thing I'm going to talk about is opportunity, educating society about the opportunity that the early years presents. The second thing I want to talk about is educating society about the challenges that currently exist in the early years. And I will finish with some thoughts from the Royal Foundation about educating different parts of society. The point being that we need to educate different parts of society differently. So starting with educating society about the opportunity, what we feel is that we need to be much more confident about relying on the body of scientific knowledge that tells us why the early years are important. I was pleased to see in the Andrea Ledson report that there were 3 pages on the science, not many, but there was some science in there. At the Royal Foundation, we have been really lucky. Our own journey of education has allowed us to talk to some of the best neuroscientists, neurobiologists, and psychiatrists, both in the UK and internationally. And some of you are on this call. And what we know from them, as you all know, is really powerful stuff. We're not entirely pre-programmed at birth. Our earliest life experiences and the environments in which we grow up shape our development. Our early childhood doesn't determine the rest of our lives, but the science tells us that nurturing relationships, the right support, builds the solid foundations for the rest of life. And over the past couple of decades, we have started to understand how adversity early in life can affect brain structure, neurobiology, and our gene expression. So we would encourage a conversation and education about the science. I know that we have to be careful not to overstate the evidence, and the base of knowledge that we've got today continues to expand. But the important point is the neuroscience of early childhood development is not itself in its infancy. It's increasingly hitting the academic headlines. And on that note, I was interested to see just earlier this month that The Scientist carried an article entitled Early Life Stress Exerts Long-Lasting Effects via the Epigenome. So we're out of the backwaters with the early years and the science of the early years, and we're into mainstream science. But the fact is that as a society, we know far more about the science behind climate change than we know about the science that explains what happens in our own brains in early childhood, or about what influences healthy development, or about how experiences in early childhood can affect later outcomes in life. What I'm saying is that the science of the early years needs to become mainstream for us all. The second point I wanted to make about selling the opportunity of the early years is that we need to move away from talking about the issue as something that just concerns children individually or just their parents and caregivers. When we do this, we all sell the subject short, and we immediately lose a large part of our potential audience. What I want to invite us all to do, and what the Foundation will be trying to do, is to talk beyond a sure start, a better start, or the best start, because what that means is we don't say enough about why early childhood matters to all of us. And we don't say enough about how society thrives when children thrive. The Duchess's own journey of exploring the early years, I think, makes the point quite well. When she started out in royal life, her focus wasn't on children, it wasn't on the early years. it was on some of our biggest societal challenges. What she was looking at was addiction, homelessness, children's mental health. And as we worked with her, we traced back to the earliest causes of mental ill health, the earliest causes of societal problems, and we were inexorably led to what happens in the very earliest years of life and the opportunity to prevent problems before they arise. So when the Royal Foundation is looking at its work in the early years, and as we've evolved our strategy, we see it not just as an opportunity to secure better outcomes for individual children, but as an opportunity to work towards a more mentally healthy and nurturing world. And just finally on this point, the Harvard Center on the Developing Child have been doing some very interesting work, I think, in looking at how best to express the opportunity that lies in focusing on the early years. In their latest working paper, number 15, I think, they look at the interrelationship between the developing brain and the body and the correlation between early adversity and chronic illness, including cardiovascular conditions, asthma, depression, and diabetes. We all know that by focusing on the early years, we won't eradicate health problems in adulthood entirely. But as Harvard suggests, and here is the power of their point, we have a chance of reducing some of the huge financial burden created by these problems. In the US, Harvard says the direct cost of the 4 chronic illnesses that they talk about is $600 billion. We just think about that for a moment in the UK. We're used to referring to that now well-known EIF figure of the 17 billion, the cost of late intervention. But we've got a much more powerful way of putting the case if we think about all the later health costs that result from not grappling with early adversity. So what I'm saying is when we educate about the opportunity of early childhood, we want to be telling the story of the science, and we want to be talking about the big picture, the way the early years matters for all society. Turning to my second theme, educating about the challenges. Today, the priority is as much about educating about the challenges in early childhood as it is about selling the positive opportunity that lies in the early years. What we need to be doing is making the clear case for action. Why do the early years matter now, when frankly, there are so many other pressures and so many other causes crying out for attention? What are the particular challenges that we need to address as a matter of urgency? We say the reason we need the early years to be on the agenda right now is because so many of our under 5s are struggling. And what society needs to know and be educated about is that if a child's outcomes are already poor by the age of 5, then the chances are that we are looking at longer term problems for that child. I'm going to touch on 4 issues that we think at the Royal Foundation are real grounds for concern. None of this will be new news for you, but these are the sort of challenges that we think we need to be educating society about. The first issue is the number of children who are not reaching a good level of development by the age of 5, by reference to the Department for Education's own early years foundation stage profile. The stark and worrying fact is that as many as 40% of children in more disadvantaged communities are not reaching a good level of development. What this means is that these children are not attaining the right levels of cognitive, social, or emotional development. Making up these gaps after the age of 5 is incredibly difficult. The second issue that we will be highlighting is the evidence of children struggling with mental ill health before they have even reached the age of 5. The last national measure of children's health, mental health, showed that as many as 1 in 18, or 5.5% of toddlers between the age of 2 and 4 had diagnosable mental health disorders. If we think about that, that's really quite shocking. So what we've got there is powerful evidence of measurable problems for under 5s at the moment. And in addition, what we have right now is a perfect storm of circumstances that mean that many of our youngest children and the next generation of babies and young children will be exposed to adversity if we do not act. Society needs to understand and be educated that the level of adversity that so many families in our society face affects the capacity of parents to foster nurturing relationships with their children. And this in turn hinders healthy development. So we would say the third challenge that we should be talking about is parental mental ill health. Perinatal mental illness affects up to 20% of new and expectant mothers and around 10% of new fathers. The coronavirus pandemic has done nothing to improve matters, and a UK-wide survey indicates that 6 in 10 new parents share significant concerns about their mental health because of additional stress. We need to explain that when parents' mental health is poor, this affects children's mental health, and think back to that 5.5% figure that I mentioned earlier. Preschool children of parents with poor mental health are 3 times more likely to have mental health difficulties themselves than children whose parents have good mental health. And the final and fourth challenge that I want to highlight and that I think we should be talking about is the worrying levels of poverty experienced by families. Together with Little Village, the Joseph Rowntree Foundation published a very powerful piece of work earlier this year, showing that relative poverty has risen fastest since 2010 for households where there is a child under 5. And there are now calculated to be 1.3 million babies and preschool children whose lives are being held back by relative poverty. Yet, what we saw during COVID was a conversation about food banks and the lack of free school meals. And I'm not saying that we shouldn't have been having that conversation, but what we needed was an equally high-profile conversation about baby banks and the plight of families with younger children. I'm going to finish talking about the idea of educating different parts of society about the early years. I've talked about some of the big themes, but what we need to think about is a little bit of subtlety in education. Because if we want to improve outcomes in the early years, then we need to influence a broad array of people with different attitudes and behaviours, all of whom have a role in influencing early childhood. Parents and carers, of course, front of mind when we think about education. When we think about educating about the importance of the early years and what they can do to support their children's healthy development. But I'd just like to make a few observations on this point up front. It's really important that we provide information in a way that does not create the impression that parenting is an activity to be carried out in a vacuum, alone, and without support. We know from our own social research that information needs to come from trusted sources, and it needs to encourage help seeking. We also know knowledge needs to be provided early enough. And ideally, we should start educating, we think, a long time before antenatal classes or even in contemplation. Learning about healthy development and why it matters is, we say, a subject that all children should be taught, as they are our future parents. In geography, children learn about global warming, and pollution, and their role in preventing climate change. In science, they should learn about brain development, neurons, and their role as future parents in promoting healthy development. Government, of course, needs educating too. But I rather think that the issue is no longer so much about persuading politicians that the early years are important, or indeed about the challenges that children, parents, and families face. There are some amazing advocates who put all of this very well. And there is, of course, plenty of work to be done in continuing to spread the message. But what politicians need to be educated about now is the economics of the early years. The cost of prevention versus the cost of cure, and the cost effectiveness or cost benefits of programs of support. The Andrea Leadsom review acknowledges that investment is needed in the early years. But I don't think anything significant is likely to change, and no investment will be forthcoming without Treasury being convinced of the economic case. So education in a different form, specifically for government. We would say the early years sector itself needs educating. There are experts out there, great experts, and many others are knowledgeable. But the shame is, and we heard this from the experts that we spoke to, that information sits in silos, and there are not sufficient mechanisms for disseminating knowledge to all that need to know it. The point was really brought home to me last November by one of the panelists who spoke at the Royal Foundation's event. Dr. Goody Singh, the panelist in question, is a paediatrician, and she told me how she wants to fight for better education of her profession, because as she explained to me, and I found this quite astonishing, development in the early years is not a mandatory part of the syllabus for paediatricians, nor is it mandatory for midwives. Training of some of our key early years professionals has not, it seems, kept up with the science. And the focus for too long has been on the physical development of babies and toddlers. We perhaps shouldn't be too harsh. The World Health Organization only published their nurturing care framework for the early years in 2018. But it is essential that the knowledge of what matters most in the early years is disseminated to all who work in the early years, if they are to be as effective as they can. Employers are, we think, also worthy of special mention as we talk about educating society. They have an essential role in being able to tangibly improve life for parents and families, building their capacity to parent. For some employers, there are opportunities to lend their support through their parental leave policies, through flexible working and childcare provision. For smaller employers, we should be appealing at minimum for a fair wage, bearing in mind that 70% of the families that I was talking about in relative poverty are in work. But why should employers be interested in the early years? Are we going to sell the science to them? For them, the case to be put is about retention of a happy and productive workforce, but it is also about securing a productive workforce in years to come. Interestingly, the strength of this argument has hit some fertile ground in the US, where I think it is some 2,000 organizations are members of an early years supporters group called Ready Nation. In the UK, we probably have further to go in getting employers signed up to the cause of the early years, but we need them to sign up, and we should get on and start educating them. The point is, as I said at the beginning of this talk, that the early years matters to all of us, because when children thrive, society thrives. And this is the essence of what we all need to know. While I can't reveal the whole Royal Foundation strategy to you. What I can say is that educating society about the early years will be a key piece of work for us and for the Duchess of Cambridge in years to come. Thank you so much for your time today.
Thank you very much, Aida. That was fascinating and loads of questions to ask you. But before we do,